Hello everyone, welcome back to Jacob's Academy of Nursing. So today we are going to discuss another topic, cardiovascular system. So the cardiovascular system is also known as the circulatory system. It is one of the most important systems of the human body because it is responsible for continuous circulation of blood. And the main functions of the cardiovascular system is to transport blood throughout the body through blood circulation. Oxygen and nutrients are supplied to all over the body tissues, so which are essential for energy production and normal circular functions. So at the same time, this system helps in removing waste products such as carbon dioxide and metabolic waste from the body. So this process maintains internal balance and supports all over the body function. And the cardiovascular system consists of three main components, like the heart, blood vessels and blood. So together they work efficiently to keep the body alive and healthy. So in this lesson we will understand the structure and the functions of the heart, type of blood vessels, blood circulation, cardiac cycle and common cardiovascular disorders like relevant for the nursing practice. So let us begin our topic. In this lesson on cardiovascular system, we will cover the following topics in a systematic and exam-oriented manner. First, we will begin with a brief introduction to understand the importance of the cardiovascular system. Next, we will discuss the components and functions of the cardiovascular system, including the heart, blood vessels, and the blood. Then, we will study the general features of the heart, followed by the pericardium, its layers, pericardial cavity and sinuses, and the blood and nerve supply of the pericardium. We will also look at the clinical anatomy of the pericardium. After that, we will cover the external features of the heart, the chambers of the heart, and the walls of the heart. We will then move on to the blood circulation, types of blood vessels, and the cardiac cycle. Next, we will learn about heart rate and pulse, blood pressure, and common heart disorders. Finally, we will discuss the nursing importance of the cardiovascular system and then summary. So let us begin with our topic with a brief introduction. Now let us understand the introduction to the cardiovascular system. The cardiovascular system, also known as the circulatory system, is responsible for transporting blood throughout the body. It supplies oxygen and essential nutrients to all body tissues and helps in the removal of waste products such as carbon dioxide, thereby maintaining normal body function and overall health. So because of this continuous circulation of blood, all organs of the body are able to work efficiently. And this makes the cardiovascular system one of the most vital system of the human body. Now let us discuss the components and functions of the cardiovascular system. First, we will look at the components of the cardiovascular system. The cardiovascular system has three main components. First one is the heart, second one blood, the third one blood vessels. So the heart is a muscular organ that acts as a pump, and its main function is to pump blood continuously throughout the body. And the second one, blood, it is a specialized connective tissue. It carries oxygen, nutrients, hormones and waste product to and from different parts of the body. And the third one is blood vessel. So the blood vessel form a network of tubes through which blood flows, and these include arteries, veins and capillaries. So now let us move on to the functions of the cardiovascular system. The first function is the transport of gases and nutrients. Oxygen and nutrients are delivered to body tissues, while carbon dioxide and waste products are removed. The second function is to maintain blood pressure, which is essential for adequate blood flow to all organs. And the cardiovascular system also help in regulating body temperature by controlling blood flow to the skin. And together, these components and functions help maintain homeostasis and support normal body function. Now, let us study the general features of the heart. The heart is a muscular and hollow organ. It functions as a powerful pump that circulates blood throughout the body. In size, the heart is approximately equal to the size of a clenched fist of the individual. It is located in the thoracic cavity, specifically in the mediastinum between the two lungs. And the heart is not placed exactly in the middle line. So it is positioned slightly towards the left side of the chest. So now let us understand the pericardium. The pericardium is a protective covering of the heart. It surrounds and supports the heart within the thoracic cavity. And one of the main functions of the pericardium is to prevent over-distension of the heart during increased blood volume. And it also reduces friction during heart movements by the presence of pericardial fluid, allowing smooth and continuous beating of the heart. So the pericardium plays an important role in protecting and maintaining the normal function of the heart. So here in this image we can see heart general features and labeling and the pericardium also. Now let us study the layers of the pericardium. The pericardium is divided into two main parts, the fibrous pericardium and the serous pericardium. So the fibrous pericardium is the outermost tough layer, and it helps to protect the heart and prevent over distension during sudden increasing in blood volume. So inside the fibrous pericardium is a serous pericardium, and the serous pericardium has two layers. The outer layer is called the parietal layer, which lines the inner surface of the fibrous pericardium, and the inner layer is called the visceral layer, and it also known as the epicardium, and this layer closely covers the surface of the heart. So between the parietal and visceral layers is the pericardial cavity. So now let us understand the pericardial cavity and sinuses. The pericardial cavity contains a small amount of pericardial fluid. So this fluid helps in reducing friction between the heart and surrounding structures like during heart movements. So there are two important sinuses present in the pericardium, and the first is the transverse pericardial sinus, which lie between the great arteries and the veins, and the second is the oblique pericardial sinus, so which is located behind the left atrium. And these sinuses are clinically important and are useful during certain cardiac surgical procedures. So the layers of pericardium and the pericardial cavity together to protect the heart and allow smooth and efficient cardiac activity. So here in this image we can see the labeling parts, the pericardial cavity and sinuses, the layers of the pericardium. Now let us discuss the blood and nerve supply of the pericardium. The atrial supply of the pericardium is mainly from the pericardiocophrenic artery. So this artery is a branch of the internal thoracic artery and supplies blood to the fibrous and parietal layers of the pericardium. And the nerve supply of the pericardium is provided by the phrenic nerve and arising from cervical spinal nerves C3 to C5. And this nerve supply is very important because pain from the pericardium is often referred to the shoulder region. Now let us understand the clinical anatomy of the pericardium. Pericarditis. So it's the inflammation of the pericardium and it may cause chest pain and discomfort, especially when during breathing time. So the second one is pericardial effusion. So it refers to the abnormal accumulation of fluid in the pericardial cavity. And excess fluid can restrict normal heart movement. And the last one is cardiac tamponade. So it's a serious condition in which fluid accumulation compresses the heart and leading to reduced cardiac output, and it's considered a medical emergency. So understanding these conditions is very important for nurses because it's early recognition and promote management to the patient to save the life. Now let us study the external features of the heart. So the first one is apex. So the apex of the heart is the pointed lower end. It is formed mainly by the left ventricle and is directed downwards, forwards and to the left. The second one, base. So the base of the heart is the upper broad end and it is formed mainly by the atria and receives blood from the great veins. So the third one is sternocostal surface. So it's the anterior surface of the heart. It lies behind the sternum and ribs and is mainly formed by the right ventricle. And the last one is diaphragmatic surface. So it's the inferior surface of the heart. It rests on the diaphragm and it's mainly formed by the left ventricle. So now let us discuss the chambers of the heart. So the heart has 4 chambers, 2 atria and 2 ventricles. So the right atrium receives deoxygenated blood from the body through the superior and inferior vena cava. And the right ventricle pumps this deoxygenated blood to the lungs through the pulmonary artery for oxygenation. And the left atrium, it receives oxygenated blood from the lungs through the pulmonary veins. And the left ventricle, it pumps oxygenated blood to all parts of the body through the aorta. So the chambers of the heart work together to maintain continuous blood circulation in the body. So here you can see the image of the external and chambers of the heart. Now let us understand valves of the heart. So the human heart has 4 valves which ensure the one-way flow of blood and prevent backflow. So they are the tricuspid valve, mitral or bicuspid valve, pulmonary valve and aortic valve. The tricuspid valve is present between the right atrium and right ventricle, while the mitral valve is present between the left atrium and left ventricle. So the pulmonary valve allows blood to flow from the heart to the lungs, and the aortic valve allows oxygenated blood to flow from the heart to the body. So now let us move to the circulation, like blood circulation. So pulmonary circulation and systemic circulation. So pulmonary circulation carries deoxygenated blood from the heart to the lungs for oxygenation and bring oxygenated blood back to the heart. And systemic circulation carries oxygenated blood from the heart to all parts of the body and return deoxygenated blood back to the heart. So the heart valves and blood circulation together help in maintaining efficient and continuous blood flow in the human body. So here you can see the image of walls of the heart and also the blood circulation. Now let us understand blood vessel and the cardiac cycle. So the blood vessels are the tubes through which blood flows in our body. So there are three types of blood vessels: arteries, veins and capillaries. So the arteries carry blood away from the heart. The vein carry blood towards the heart. And the capillaries are very thin vessels where the exchange of gases, nutrients and waste products take place between blood and the body tissues. So now let us move to the cardiac cycle. So the cardiac cycle refers to one complete heartbeat. It consists of two main phases, systole and diastole. So the systole is the phase during which the heart muscles contract and pump blood out of the heart, while diastole is the phase during which the heart muscles relax and allows the chambers to fill with blood. And this continuous sequence of contraction and relaxation ensure effective circulation of blood throughout the body. So the blood vessels and the cardiac cycle together play a vital role in maintaining normal blood circulation. So here you can see the blood vessels, three types of blood vessels and also the cardiac cycle image for your reference. Now let us understand heart rate, pulse and blood pressure. So the heart rate refers to the number of heartbeats per minute. So the normal heart rate in adult range from 60 to 100 beats per minute. And the pulse is the rhythmic expansion and contraction of arteries caused by the heartbeat. And it can be felt at the arteries. So the most common site for checking the pulse is the radial artery at the wrist. So now let us move to the blood pressure. Blood pressure is defined as the force exerted by circulating blood on the walls of the arteries. So the normal blood pressure in adult is 120 by 80 mm of Hg. So when blood pressure remains persistently high, this condition is known as hypertension. So therefore, monitoring heartbeat or the heart rate, pulse and BP is essential for assessing the overall health of the cardiovascular system. Now, let us discuss some common heart disorders. So the first condition is hypertension. So which means persistently high BP. If it is not controlled, hypertension can damage blood vessels and increase the risk of heart disease and stroke. The second one is coronary artery disease. So in this condition, the coronary artery that supply blood to the heart become narrowed due to fatty deposits. So it will reduce the blood flow to the heart muscles. So the third one is heart failure. So in this condition, it does not mean the heart stops working, but it means the heart cannot pump blood efficiently to meet the body's needs. So it will lead to fatigue and breathlessness. So the last condition, which means MI, like myocardial infarction, so which is commonly known as heart attack. So it occurs when blood supply to a part of the heart muscle is suddenly blocked. So it will cause damage to the heart tissue. So the early detection and like healthy lifestyle and regular medical checkups are essential to prevent and manage heart disorders. Now let us understand the nursing importance of the cardiovascular system. So nurse plays a vital role in monitoring vital signs such as heart rate, pulse, BP and respiration. So which helps in assessing the patient's cardiac status. So they also assess heart sounds to identify any abnormal sounds that may indicate cardiac problems. So the early detection of cardiac abnormalities by nurses, which helps in preventing serious complications and improve the patient outcomes. So the nurses are the responsible for administering cardiac drugs safely and monitoring patients for therapeutic effects and also the side effects. So they also play an important role in educating the patients about lifestyle modification, medication complications and diet, exercise and follow-up care. So since the cardiovascular system is essential for life, effective nursing care for the maintaining heart health and promoting overall well-being. Now let us summarize the cardiovascular system. The cardiovascular system is also known as the circulatory system. It consists of the heart, blood and blood vessels, and the heart acts as a pump to circulate blood throughout the body. And the pericardium protects the heart, and the heart has 4 chambers and 4 valves to ensure one-way flow of blood. Blood vessels include arteries, veins and capillaries. Pulmonary circulation carries blood from the heart to the lungs, while systemic circulation supplies blood to the entire body. The cardiac cycle, which includes systole and diastole, which together form one complete heartbeat. And the cardiovascular system helps in maintaining oxygen supply, nutrition and waste removal. It also regulates blood pressure and body temperature, and it's an essential system for survival and nursing care. So understanding the heart rate, pulse, blood pressure and common heart disorders and nursing importance is very essential to provide effective patient care. So with this we concluded today's session on the cardiovascular system. Thank you. Thank you so much for watching today's session. So if this class was helpful, please like, share and subscribe to Jacob's Academy of Nursing. So see you in the next class. Bye.